Is this the first ever cancer screening test for dogs where we can actually go to the lab and figure out if your dog has cancer? Well, according to Dr. Andrew Jones, who is a fantastic veterinarian, he has an amazing YouTube channel, the Nu-Q vet cancer test can actually do this. Now, it's super important because, number one, 50% of dogs over the age of 10 will develop some form of cancer. Best part is it's pretty cost effective and it's easy to use. So while the test isn't perfect, it does give us a much better look into whether or not our little dog has cancer. Well, this works pretty well with seniors. What it does is it analyzes nucleosomes given off by cancer cells. This gives your vet an indication of what can be going on. Now, the cool thing is that in published research, it was able to identify 7 different types of cancers and did a really great job with 76% of systemic cancers, including lymphoma, histiocytic sarcoma, and a few others. And it identified them with 97% specificity, which is extremely impressive. Now, as you can see, there are different percentages for each of the cancer that it can identify. Now, one of the major things you have to watch for is that the test may not be able to differentiate between what they're calling significant systemic inflammation and cancer. However, keep in mind that if your dog, especially a senior dog, has significant systemic inflammation, they're already in trouble and they could be headed down the cancer path. And even if they're not, that needs to be addressed pronto, because that can lead to all sorts of horrible things that even though are not cancer related, like joint pain, brain fog, even dementia, problems in the organs, all kinds of things that are just absolutely horrible for senior dogs. So what's the big deal about this? Why use the screening? Why not just get blood tests? And anybody who watches this channel knows that I'm very big on getting senior dogs blood tests twice a year, doing a senior blood panel. The issue is blood tests do a really good job of finding out a lot of problems, but they're not great at finding cancers, not always. Take the example of Genghis here, who 10 months ago was diagnosed with a form of lymphoma. And before that, there was really no indications that there were anything wrong. She had one symptom, and that was that she was drinking an inordinate amount of water. Both the veterinarian and I figured maybe she's getting to become diabetic, so we ran a blood test. The results were absolutely perfect. The problem continued sporadically until we got a second blood test done roughly 6 weeks later, and again, the blood tests were perfect. The veterinarian said, listen, these results look like the results of a 2-year-old dog, not a senior. In fact, it wasn't until about a month later where we started to see a mass actually form, that we were able to take her in and get a CAT scan and have tests done, that it was revealed that yes, she does have this cancer. Now, luckily, after a horrible experience with the first oncologist, we found a better one, and she was able to get a fantastic form of oral chemotherapy that hasn't given her side effects, and she's thriving still 10 months later. But had we had this test, it would have been a lot better, because there's always the chance that had we known in the very, very beginning, we could have started treating it earlier and maybe knocked it out. But that's something that we'll never know. So back to the screening. One thing Dr. Jones points out that it is only available in North America, so Canada, the US, and Mexico. However, more recently, it is actually being rolled out internationally. I know it's available here in Italy, and it's probably going to be coming to wherever you are very soon, so ask your vet about it. From the information I've seen, I haven't been able to determine whether or not it should be a yearly test or something if we're only seeing some sort of issue going on, but something you should talk to your veterinarian about. And before we go, this is something interesting. Dr. Jones is a very progressive veterinarian, and one of the things he writes here in this email is we want to try to prevent cancer in the first place, and that one of the easiest way to do it is to focus on nutrition and go to no or low kibble, which is what I've been preaching here for a long time, and one of the reasons why all of my dogs have eaten home-cooked food for many, many years. So talk to your vet, see if this Nu-Q is the name of the test, if the Nu-Q screening is right for your senior dog. In the meantime, if they're on kibble, try to get them off. Go ahead, or if they have to be on kibble because, well, for whatever reason, just go ahead and try to use some really healthy homemade kibble toppers, and if possible, go ahead with the healthy homemade dog food recipes you're seeing above us, as Genghis will attest, and all the dogs here, they absolutely love it, and I bet your dog will too.